Okay.
So my question is, if you are caring for a patient with rubella, what are the acceptable PPEs for you to use? Let's say if you have this as a question and you have options like A, being gloves, surgical gloves, or examination gloves. You can have any kind of option, but you should know which one is right for you to choose. For instance, if you see sterile glove or surgical gloves, you can't use surgical gloves for emptying urine, just like that. You can't do that, right? So no matter what you see, there will always be a right answer. So if you see surgical gloves and you see um, examination gloves, you know that we use surgical gloves for sterile purposes and examination gloves for normal things. Just for normal contact precautions, right? And remember yesterday too, I told you if you see just gloves, if you see gloves without being specified, take it as examination glove, right? And when you see mask without being specified, that it is either N95 or something, just take it as what um, normal surgical mask. Okay, take it like that. So back to my question. You are next caring for a patient with rubella. What are the PPEs acceptable for use? Mr. Philomena, let us hear
Yeah.
you again. Mhm.
So with the rubella, that one is airborne. So we'll go in for N95. We'll go in for gown, your gloves, and then goggles.
Okay. Who agrees with her with the answer she just gave? Who agrees? If you agree, raise up your hand. Okay, Sarijana, do you agree?
Yes, please.
Oh, yes.
Okay. Mr. Sandra, do you agree?
Yes, please, I do.
Okay, who doesn't agree here? So everybody agrees, eh? Because for me, I don't agree. So who will join me? I don't agree, so who will join me? So when you're caring for someone with rubella, the only thing you will need is your 95. That's all. Nothing else. Hello, are we there? The house is silent. Are we there?
Yeah, yes,
Yeah.
so we are here.
So you see how simple and tricky these questions can be. They are very simple, but they are very tricky. When you're caring for someone with tuberculosis, what are the things you need? It's only a 95.
95.
Nothing else. What are you going to use the how do we call it? What are you going to use the gown for?
Yes,
Okay.
it's for body.
Because
Protect
there's
you.
not on
It's for body
unregistered
Yes.
lesion.
Good. So the question has not specified any procedure you are going to do or something. You are caring for this patient. Okay. Or you are entering. So always pay attention to um pay attention to questions so you see this one, it doesn't mean you don't know. You know very well. Everybody here knows what we are saying very well, but the thing is how to relate it in real life questions. That is what sometimes becomes the challenge, right? So when you are caring for someone with droplets, I would want to ask you questions on that one too, but let me just say it so that you'll be aware. When you're caring for someone with, let's say, droplets like influenza or flu, what you need is what? Okay, someone should tell me. Let's see. What will you need? Oh, we shouldn't
Your
keep all of
gown
them.
and gloves.
Your gown and what?
Your gloves.
Droplets. Okay, so let me tell you something about this. When
You
it comes
need
to
just
glove,
your mask.
when it comes
Just
to
some.
gloves, please, glove runs through all of them. So take this one too as a tricky thing. Okay, when it comes to airborne droplets, contact, or whichever, please just take note that gloves run through, like it runs through all of them. Are we there? Gloves runs through all of them. So normally, if you have options and you have just gloves, okay, attached to it or examination gloves, you can add it to whichever option. I mean, whichever precaution. It's like you know, you need glove to do a lot of things. Even if you are giving medications, right? And you are caring for someone without any communicable disease. Like let's say you are caring for someone with diabetes. Diabetes is not a communicable disease, you know, but when you are performing certain procedures, so let's say even when you are serving medications like oral medications, you have to put on gloves. You know that acceptable way. Okay, don't measure that task or don't narrow it to your ward. Okay, depending on where you work, and think of it as such that maybe your ward you don't do that, so maybe it is also done elsewhere. Okay, if you are giving medications, you have to put on gloves. It doesn't mean that someone is contaminated or something, but it's just a standard procedure. So it's like no matter the kind of isolation precautions you have, gloves runs through all of them. So when you get airborne condition like the example or the question I gave you, let's say you have someone with tuberculosis and you want to take care of the patient, what PPE? If there is gloves there, add gloves. Okay, but the main thing used in airborne is what? Your N95. If you don't see N95 and you see some other thing, you have to choose. What is that? What is that thing? If it's not N95, what is that thing? Who can tell me? It works. I mean, it does the same work like
Respirator.
the respirator. Okay. So when you don't see N95 and you see respirator, it is the same thing. In options, you can never see a 95 and respirator at the same time because they all do the same work. So you find one. So either a 95 or respirator, that is your main thing for protecting yourself from airborne conditions. Gloves, like I said, if you see that option there to add gloves to it. Okay. When it comes to droplets, the main thing is what? Your gown and your surgical mask. Okay. Your mask and your gown. Those are the main things used in what? In droplet precautions. But when there's gloves there, add gloves to it. Please, are you appreciating what we are saying? So that it doesn't become like but when you get questions on them, you get them wrong. Have we gotten the trick?
So please, you said with the droplet, the main thing is mask and what?
We talked about it yesterday that it was mask and gown.
Yeah.
So 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 when you are going to dress wound, um you see when you're going to take care of wound, like perform wound irrigation or dress wound, take it as a droplet. Okay. That is also another trick I'm just mentioning. Just keep in mind. So take it as such. Um let's say you're going to suction. For suction, it's one easy way we can realize what we are saying because you can have secretions. Sprinkling all over, or I mean, you know what I'm talking about. You can have secretions. I mean, you can have even I don't want to even say like you know what I'm trying to say. Yeah, you can have secretions getting anywhere if you are not protected, right? So with the droplet, you have your. I think I even left one thing with the droplet. You have your gown, your mask, and what your face shield or your goggles. Okay, these are the three things, the main three things for droplet. Your mask, not respirator or N95, just surgical mask. So your mask, your gown, then your goggles, so that if there's any sprinkle, you can't get them on your face. Okay, that's why you should have a face shield or a goggle. I mean, goggles to help protect your eyes. So these are the three main things used in droplet. If you add gloves, like I said, gloves runs through all of them. So that also becomes part of the answer. And when it comes to contact, contact is only your gown and your gloves. Contact is only your gown and your gloves. That's all. You don't need anything again. So know the specifics, like we displayed them yesterday. Know the specifics. If you know the specifics and they mention the condition, if you're able to tell that this condition is droplet, like I use rubella as an example. I use rubella as an example. So the person who answered had it correct that yes, it's airborne. So if it's airborne now, the question is, what should I use in airborne precautions? Then you choose your answers. Okay. One last question, then we can carry on. Now rubella. Because I use rubella, let me use rubella right now. Mr. Regina, you have a question?
Yes, please.
Mm-hmm.
So please, with the airborne, we are only using the N95 or
Yes,
only
N95. That is
N95.
yes, only N95. But if among the options you have gloves, add gloves to it because I said gloves runs through all.
Oh, okay. But
So
if
there is
there is
no gown. There is no gown in airborne. There is no goggles in airborne. There is nothing. Only respirator or N95 for airborne. That's all. So right now, let me ask you: should you have a patient with TB and you want to enter the
mm,
room?
mm,
Are you going to gown? If let's say you are going to just give medications to the patient, are you going to put on gown?
no, please.
No.
No, N95.
Only
N95.
N95. Then, if possible, your surgical glove. Okay.
But
So
please, what
that's
about the chicken pox?
yeah. So chicken pox too is airborne. So the only thing you need is your surgical your surgical. How do I
Yeah,
say?
please, the airborne to use surgical
Uh,
or
uh, please,
no.
airborne. We don't use surgical. I mean, just a slip of tongue. Airborne,
Okay.
yes, airborne. It is always please. So we don't use. We are not saying we use N95 for some airborne. It is for all airborne. I mean, that is what is there. Okay. So not that it's for some airborne conditions. It's for all airborne conditions. So take it. Are we there? All right.
Yes, please.
If you
Thank you.
so that is it. And if you are caring for, so let me give you a trick. Someone has asked a nice question. I don't know, maybe our attention haven't been drawn to that side. So always, if you understand how these things work, you know how chickenpox spread. Apart from being airborne, do you know that chickenpox can also be contact?
Yes, please. You taught us yesterday.
Yes, but when you see it in question between airborne and contact, please choose airborne. If you are supposed to choose only one answer, please choose airborne. Let me repeat that again. If you see, maybe you're supposed to choose one answer for chickenpox, okay, or for varicella zoster, should you fall between the options airborne and contact, choose airborne. Okay. Yes. But we also know that if you get into contact, like close contact with someone with varicella zoster, which is the chicken pox, even if you are in N95, you can still get, because you can also get it through contact means. Okay. So when maybe, I don't know, NCLEX is, I mean, for NCLEX, everything is possible. So if they give you a scenario that you are going to perform a procedure of which you are going to get very, very, very close to this patient, please, you should add gown. Are we there?
Yeah, that's why I was asking.
Yes. So, like, generally, you can't say gown is part of airborne. It is never like that. It is only N95 and your gloves. But they can give you a tight question. Okay, you know how chickenpox is, which is varicella zoster, right? You know how it is. I'm repeating myself. If you fall between the options airborne and contact, choose airborne as your number one. And like I was saying, we all know that you can also get it through contact. So if maybe a question comes like, we are going to dress a wound for someone with chickenpox, please, it is a like, it's like a customized, it's like you have a general, like everybody has something which is general, but you going for like a customized something. So it means that situation before you is a customized situation. When I say it's a customized situation, it means there are some modifications that have to be made. Okay, which are the modifications? The person has chickenpox. Chickenpox alone should raise the concern that you should have what? I mean, N95. That is one. What are you going to do for this patient? You are going to dress the patient, or you are going to change the patient's dressings. So you get in touch with the person. You will get very close. Of course, it will make it, even someone who is not educated, like, um I don't want to, I don't want to be offensive, but I mean, people who don't have this nursing knowledge or health knowledge, they would, I mean, they even know that when you get closer to someone with chickenpox, you can get chickenpox. And we all know that. Okay. So in this your customized situation, you are going to dress wound. That's what the question is saying. So what will you do? N95. And you put on your gown because of what you are going to do, and because of how close you are going to get to the person. Okay, then what else do you need for wound? You have your glove, because it's a wound nature. Even though goggles is not part of what, of airborne precautions, but because you're going to dress wound, you have to put on face shield or goggles. So that is the kind of customized thing that I'm talking about. Please, you all understand it. You can get customized cases. So understand it and you know what to do. Okay. So let's say if someone is having, let's say, tuberculosis and you're going to dress wound, if it happens to be a normal person with wound, you're going to put on what? Just a surgical mask, your gown, goggles or face shield, right? But when the patient that you're going to dress his or a wound has tuberculosis, you are going to change the surgical mask towards N95 and you maintain the rest. So these are customized things that normally happen. Please, do you appreciate it and do you understand what we are trying to say?
Yes, please.
Yes, please.
All right. Any question before we carry on from where we left?
Yes, but I have a question.
Okay.
So if they ask that you are going to dress a wound for such a patient, I'm confused because I'm confused between the normal examination glove and sterile glove since it's a wound dressing. Which one am I supposed to choose?
So let me pick it up from from this point, okay, of your question. When you're going to dress wound, what kind of gloves will you pick?
So you first wear the normal gloves, the normal examination gloves, and then when you get there, you open and then you put on the
Yes.
sterile.
Yes. So in this question, they will not even ask you sterile or maybe examination gloves.
Exactly. That's why.
Oh yes, because in wound dressing you are going to use both of them. Okay.
Exactly.
Yes, so they'll just say gloves. Okay, so when they say gloves, whether it's surgical or it's examination, you are going to use it. So that becomes
Okay, so they will not let you choose
oh
between
for
the
for
two.
questions like this, ever since I started looking into enclave stains for the past few years, I've never seen any specifications like that. They'll just say gloves. Okay.
Okay.
Yeah,
Okay.
they'll just mention the PPE. Where they will be um maybe specific about the type of glove will be in questions like, let's say you are a nurse. Sorry, what will, or let's say the nurse will intervene when he sees maybe the UAP doing one of these things or something like that. And the first one will be like maybe emptying urine with double gloves. Okay.
Okay.
Maybe trying to maybe empty urine with sterile gloves or something like that. For those questions they can specify, but just for precautions, it's hardly for them to make that specification, except for masks. Okay, for gloves, they normally say gloves. Normally. But for mask, because we it's very important, so they will state it. If it's N95, they'll say N95. If it's examination gloves, they will surgical mask, they will say surgical mask. And please, if you see just mask, like I said yesterday, take it as surgical mask. Okay. It is like when in questions when you see the nurse is caring for a patient, take it as RN. Don't take the nurse in that question as UAP or LPN. When you see questions like the nurse is caring for, please always take the nurse as the RN. All right. Can we continue? Okay. So this was what we were looking at. And let me ask you a question here too. Because we are talking about HIV, right? When you have a pregnant woman who has been very, very compliant, okay, pregnant woman with HIV and has been very compliant with her antiretroviral drugs, when she gives birth to her baby, can she breastfeed her or not?
She can. She can.
They can.
Okay. So to your for your information,
Can't.
on the English, you can't.
Mm.
In Ghana and in some countries, like some other countries, you can, and we are all aware, right? On the English and in the US, you cannot. So it came in mind that I should mention it here for you to know. When you see it, it's English question. Okay. So just take note of it. When you get questions like that, you cannot. Even if they show very, very low or no viral loads, you cannot breastfeed. All right. Let us carry on. So, let us pick it up from here. Yeah. What we can teach people when, or some teachings, okay, when someone is taking antiretroviral drugs. So we are saying this is a medication regimen consisting of multiple drugs to manage and prevent progression of HIV infections. Antiretroviral drugs impairs viral replication at multiple points, leading to decreased viral loads and increase your T helper cells or CD4 counts. When educating about ART, it's critical to explain that the treatment is lifelong, okay, and it requires strict adherence to the treatment regimen. Even with undetectable viral loads, people remain infected, okay, with HIV, and discontinuation of the drug or poor adherence to the drug can result in the progression of the disease leading to AIDS. And it also promotes I mean, viral drug resistance. Yeah. So, let me ask you one funny question too. Another one. You have two couples. They all have HIV and they are all taking their drugs. And they have normal unprotected sex.
Yes, sir.
It's funny question there.
Wait, did you say both of them are infectious? I didn't get the question.
Oh yes, I mean both of them are having HIV, right? And they are all taking their medications.
No, they can't have unprotected sex.
So why can't
Why
they have?
can't they?
That's my
Why
question
can't
too.
they if they are both having? What are
Yeah,
they preventing?
I'm thinking though they are both on medication, but it will also depend on um what stage of of each of them. Yeah, depending on the individual immune system. It could be that one of them is better than the other, so one can still. I don't know. Can't explain myself well, but it's no.
Yeah, so I understand the kind of explanation you want to give. I understand you well.
Hmm.
Yeah,
Yeah.
so the issue is no, okay? Or the answer to my question is no. And I know in real life
Can I
situations,
say something?
wait, when I'm done, you say something. In real life situations, I think things can be different, okay? No one cares about anyone. But for the
So when,
purpose of
how would they have babies?
that's why I'm saying for the purpose of enclaves, okay? Yes, for the purpose of enclaves, they cannot have unprotected sex. So if they want to even meet, or if they want to meet, they will have to what? Wear condoms. Okay. That is according to enclaves. So when you see it that way, don't try to translate it in your own meaningful sense. Okay. Some things, not everything makes sense, but you have to, I mean, you have to try and get what is right out there. Because if you don't take it that way and you get questions like that, this is very, it's a very tricky and nice English question too. Okay. I know even people, couples, okay, in real life situations, couples who, let me say, you can have couples living together with only one person infected, and they are even having normal sex life and everything, even without protection.
Sir,
That
can
is
I
that
say
is
something?
ongoing. Okay.
I have.
Yeah, I'm
Please, can I
coming.
say something?
I'm coming. Wait. Wait, you all say something, and I'm interested in do something. I want to hear them. Uh, I mean, we are all adults. You know what I'm trying to talk about, right? Yeah, so it's different from what is outside there, and it's different from, I mean, what we must get right to score or to get points on the NCLEX. So just for you to know, on the NCLEX, they can't have unprotected sex. Okay. And another reason for that is that um our sister said I mean they might be in different stages, okay. But I mean the other thing that you can also talk about is how, I mean, the nature of their infection. Okay, the nature of their infection. Do you know that you can get two people with HIV? One will be treated, or one might be treated with acyclovir. The other person might be treated with maybe abacavir or something else, depending on the strains. Okay, so the issue is when they end up meeting without, I mean, protecting themselves, they exchange strains and they build resistance and they make treatment difficult. I mean, that is what the reason or the rationale says. Okay, I know it won't make sense to a lot of us here because at the end of the day, life must continue, right? But this is what's on the ankle, so just to let you know. This like you see before you come in, our brother, was it Franklin? Let him speak before you come in, okay? He wanted to speak first. Where are
Okay.
you? Where is our
Oh,
brother?
please, you said what I wanted to say already.
Oh, okay. With the different viral strains.
With the intercourse between the two infected individuals.
Oh, okay. Okay. All right, this I can see.
Okay, sir. Please, you were saying something about a pregnant woman and a HIV. I didn't get the question or the answer, and the network took me off. So I want clarification on it. Thank you.
We were talking about pregnant, like an HIV infected
Yes, yeah,
pregnant woman
yes. Yes, something like that.
who is very compliant, okay, to her antiretroviral medications. When she gives birth, can she breastfeed? That is the question we asked, and we said no. Okay.
Okay, sir.
All right. Any other question? Can we move on? Okay.
Hello, sir. Please, what if they are compliant and now they want to give birth? What should they do?
If they are compliant and they want to give birth, the easiest way to escape this question is go and see your doctor, right? That is just by the way. But it's funny. I mean, it's interesting. It's interesting. There's always a way. Okay. If they want to give birth, whatever it is, they have to have what unprotected sex. That's the only way you can give birth. Without it, because if you want to even do this in vitro thing, or like you want to transfer semen or whichever, it's still your body fluid and it's still infected. Okay. But yes, in fact, they can HIV couples can give birth with guidance. They can give it. Doesn't mean that when you are when you have HIV, you can't give birth. So both of you will have to take the medication when you give birth. It's, I mean, it can be, I mean, it's always, should I say always, or what adjective should I use here? Let me say mostly, okay? Yeah, let me use mostly. Mostly in such cases, the child, okay, or the baby that comes out of such family or such families generally, they remain, I mean, unaffected by the virus. Okay. And we keep we keep monitoring them. I've forgotten. There was a time I saw a question about that too. Like if a parent with HIV gives birth, like I don't know who has seen that before somewhere. Like how often we should check on the patient the baby before we can clear the baby that he or she is not infected. I think I remember up to 2 years. I remember up to 2 years. Like we have to do some periodic check-ins for up to 2 years. If after 2 years the baby is not infected or the baby tests negative, I think I remember something like that. Someone can put it somewhere and look for it. Okay, but I remember if my memories, it's been a very long time I read that question. So if let's say I'm a mother, HIV infected mother, I give birth, even though my viral loads were still low, the baby can never be cleared until I think 2 years. And the 2 years I'm saying there's a question mark. I remember 2 years, but it can be it can vary a bit, but someone should just find out and maybe the person can share with us. Any other question or contribution? I don't know whether I answered the person. So um to summarize to summarize your answer, yes, they can have sex and give birth. Okay. I mean if they want to give birth, they can give birth. But the priority over here is to make sure that the baby is safe. Okay. Yes, the priority is to make sure that the baby is safe. And someone should also, yeah, I think that is all. Yeah, I think that is what I remember about that. All right. Now let's look at what we have here. The second option or the second point here says latex or polyurethane. Okay, latex or polyurethane barriers should be used for sex to prevent STI. Non-barrier conception and natural skin condoms. So most of the time, especially an example of natural skin condom is the lambskin. I haven't seen some before, but I've seen them use this word in questions. Okay, lambskin, like as part of natural skin condom. I don't know how it feels like anyway. So we are saying the first part. Check it well so that you know the first part up to here is the correct aspect. Okay, latex or polyurethane barriers should be used for sex to prevent STI transmission. Non-barrier conception. So this is another thing that this bulleted point is informing us. So non-barrier conception and natural skin condoms. So you don't see natural skin condoms and you see lambskin. We are saying they offer what poor protection against HIV and STIs because you can have organisms traveling through those. There are pores in them. Okay, the reason is that there are pores in them, of which those organisms can travel through them. Any question on this one? If not, then we carry
Can
on.
you please explain the second one again?
So the second one we are saying non-barrier contraception. Okay, so non-barrier contraception. Um, Non-barrier contraception can be anything. Okay, let me be plain. Let me ask you. Let me even put it in the form of question. Is when you say contraception, what does it mean?
For
Hello.
contraception, it's like you preventing Me, what I understand is that are you preventing pregnancy?
Okay. Also, contraception is prevention of pregnancy. Are we all on the same page? Hey,
Yes.
are we?
Yes.
Contraception is what?
Yes.
Is yes. I
Yes.
mean, it's
Using means to prevent pregnancy.
okay. So I want to ask you a question. That's why I started from here. So if you do something, or let's say if you practice something like our males, our guys, are you here? If you practice something like coitus interruptus, you know coitus interruptus, right? Can it be termed as a non-barrier contraception? That was why I was
Yes.
asking.
No, sir.
So yeah, are you
Yes.
sure?
It is a non-barrier.
Yes, yes,
It,
yes,
it
yes, it is.
you know that coitus interruptus is one way people prevent contraception, or I mean, people prevent
Natural
themselves
method.
from getting, yes,
Mm.
from getting pregnant. Okay, and it is non-barrier. They don't weigh anything, right? So just at the climax or when you're about to release, then you pull off. Okay, yes. So that is one example of non-barrier what contraception. So what it means is that at the end of the day, I mean, you don't have to release before you can be able to get infection. That is what this point is trying to say. Okay, you don't have to, um, release whatever you want to release before either of you can get infection. That is why we are saying it is, when you involve yourself in that, you can still get your infection. And the second point here is also saying that natural skin. So some people might think that with polyurethane and latex um, condoms, they don't feel anything. So they will go in for what something which seems better for them, being lambskin or something. I've not seen it before, but it's also one way that people use for these things, right? Yeah, so what we are saying is that just take note. For this one, you have to take note. And the question I saw, they just mentioned lambskin. Okay. So when someone uses lambskin, just know that it is not effective to protect him or her from getting what? HIV or any form of STI. Are you there?
Yes, sir.
Okay. Let's carry on. So I have some questions for you here. The nurse provides, oh, someone should read this one for us.
The nurse
Please.
provides home care instructions to the parents of a child with acquired immunodeficiency syndrome. Each statement by the parents indicate the need for further teaching. 1. I will wash my hands frequently. 2. I will keep my child's immunization up to date. 3. I will avoid direct, unprotected contact with my child's body fluid. 4. I can send my child to daycare if he has a fever, as long as it is a low-grade fever.
Yeah, who wants to try?
I can go for number 4 because low grade fever, they are already immunocompromised. So low grade can mean something.
The nurse provides home care instructions, which it indicates the need for further instructions or teachings. What are we searching for here?
The bad comments.
Yes.
Inappropriate comments.
Inappropriate comment.
Okay. Do we all agree to what our sister said?
Yes.
Yes.
Okay. If you don't agree, let us know so that we can help you. Okay. Okay. So yes, that is correct. Let us look at the answer. Okay. Let's pick the next one.
A healthcare provider prescribed laboratory studies for an infant of a woman positive for human immunodeficiency virus. To determine the presence of HIV antigen in the infant, the nurse anticipates that which laboratory study will be prescribed for the infant. 1. Chest X-ray. 2. Western blot. 3. CD4 blood cell count. And 4. P24 antigen assay.
Okay.
This one is easy.
3.
CD4.
You see, someone said this one is easy, but have you seen that people are choosing different answers?
Yes, 4.
So someone said it's 2, someone said it's 3, someone said it's 4. But why are you not choosing one? Hey, are you quiet? So yes, the answer is 4. Okay. The answer is 4. A healthcare provider prescribes laboratory studies for an infant of a woman positive for HIV to determine the presence of HIV antigen in the infant. The nurse anticipates that which laboratory study will be prescribed. So, which laboratory study is prescribed to determine the presence of HIV antigen? So, it is only the P24 antigen assay. Okay, this one you have to know. Just keep it in mind. Okay, and let us look at first. I'm coming. Okay, let us look at the rationale and see. All right. First, you can ask a question now.
I was looking for ELISA test, but I think after the rationale, I'm getting it. I don't know if it is the same as the P24 antigen.
I don't know, but I think it will be different.
Okay.
Someone can find out some of these things. Someone can just find out and tell us. But I think it will be different. Someone should find out. At least it will be different. Yes. Anyone? Hey, no one. Okay. Let us carry on. But I'm sure they are different. Yes, they are different. All right. Let's look at this question. So please, let me also draw your attention to this. Kindly take time and read small, okay, about Western blot. Take your time and read small about CD4. We know something about it right now, and about PS20. Sorry, P24 antigen assay. Okay, P24 antigen assay. Kindly,
Mr. Gia,
yes.
concerning the P24 antigen assay, I think the other name is ELISA P24 antigen test.
Oh, okay. So you still have
The
the P20.
P24, yes,
Okay,
attached to it.
okay. Thank you. Thank you. Okay. Okay. Thank you very much. So there are some things we can just search and see. But so I also have a follow-up question. So the P24 ELISA test, is it different from the normal ELISA, or it's the same thing that we've been shortening it? That is my follow-up question.
They are saying that it is the same. I searched, is it the same? And then they're saying that it is the same, but
Okay.
uh,
Okay.
they are not the
Mhm.
same thing. Uh, let me read. The
Okay.
ELISA can be used to detect the P24 antigen, which is
Okay.
a core protein of the HIV virus, but they are not the same.
Okay. Okay. All right. Thank you. Thank you for sharing all of those things. So let us write them down, okay? Let us write them down and maybe read more about it. Just know what they do. Yeah. You don't have to know for the purpose of English. You don't have to know into details or something. Just know what they do. What's the Rita? Your hands are
Okay.
what are it old hand or new hand?
No, old hand. Sorry.
Okay. All right. This is Rita.
Yeah, hello. I just want to find out the spelling of the Elisa thing. How
Oh,
do you spell it?
ELISA.
E
E
L
for
I.
elephant. Okay, let
Mm-hmm.
me see if I can write. Elisa. Eli is
Mm.
dancing. Okay.
Oh, okay.
Elisa.
Thanks.
Okay.
All right. Thanks.
Yeah, welcome. All right. So just take note. Remember, like I always say, when you get options or when you're solving questions and you see things like this, you have to be interested in it because you don't know if they can be your major question somewhere one day. All right. I think I have another question here. Someone should take us through.
The mother with human immunodeficiency virus infection brings her 10-month-old infant to the clinic for a routine checkup. The healthcare provider has documented that the infant is asymptomatic for HIV infection. After the checkup, the mother tells the nurse that she is so pleased that the infant will not get HIV. The nurse should make which most appropriate response to the mother. One, I am so pleased also that everything has turned out fine. Two, because symptoms have not developed, it is unlikely that your infant will develop HIV infection. Three, everything looks great, but be sure that you return with your infant next month for the scheduled visits. Four, most children infected with HIV develop symptoms within the first 9 months of life, and some become asymptomatic. Some become symptomatic sometime before they are 3 years old.
Okay, so who wants to try?
I would think
Mhm.
I will, I don't know, I might be wrong. I can choose the number four because the mother is implying that the child might be free from HIV, which is not the case. So you have to let the mother know that some children can be asymptomatic up to the age of 3, so that she doesn't get the impression that a child is free of HIV.
Okay. Okay. Anyone with different answer? Hello. Do we all agree?
Yes, sir.
Yeah.
Okay. Let us look at what we have. Yes, so we had it. Okay, we had it. Let us look at the answer. The rationale. Then carry on. All right. Let us carry on. The next question.
A
A
6-year-old.
6-year-old.
Okay.
I'm glad I have plenty readers right now.
A 6-year-old child with human immunodeficiency virus has been admitted to the hospital for pain management. The child asks the nurse if the pain will ever go away. The nurse should make which best response to the child?
Mm-hmm.
One, the pain will go away if you lie still and let the medicine work. 2, try not to think about it. The more you think it hurts, the more it will hurt. 3, I know it must hurt, but if you tell me when it does, I will try and make it hurt a little less. 4, every time it hurts, press on the call button and I will give you something to make the pain go away.
So you see, this one looks like therapeutic communication question. Have you seen it?
Yeah.
Yeah. So what do you think the answer is?
3.
I think 3 is better. Who doesn't agree?
Yes. Yes.
I hope as soon as you saw the question,
Go on.
you chose 3. You didn't choose any other answer, right?
Yeah.
3 is better. Yeah, so I think it's 3. But if you don't agree and you have any question, you
I'm
can
also
bring it.
thinking it's 4.
Go all
I'm also thinking
away.
it's 4.
Mm-hmm. Every time it hurts, press on the call button and I will give you something to make the pain go away.
Go all away. All away.
Oh,
That's everything.
Leaving the
go
all. But
I don't
all,
all away.
can you make
Can
all
you
the
can you
pain
make
go
someone's
away?
pain go all away?
Mm-hmm.
I mean, that's my next question. You can't make
So does
someone's
it mean
pain
that,
go all away.
yeah, does it
Yes,
mean that
sister.
if in every 2 minutes the child presses the doorbell, the callbell,
You
you
give
give him
something.
something?
Mm-hmm.
That's also another question.
But yeah, I think pain cannot go all the way at once like that.
Mm-hmm.
Yes, yes. I like the way we are deducing answers, right? We are not. You see, we are not adding. Yes, that's how the tricks are. We are not adding different meaning to it. We are being factual for every. You see how we are just deducing our answers. We are doing it in a factual manner. We are not adding extraneous things to it to suit our own understanding, right? And at the end of the day, you can see that this one will not be a good choice. Franklin, you asked this question, and I think there was another. I heard another voice. Do you understand now, or you still need more
Yes,
explanation?
please.
Come again. You still need more explanation.
Okay, I'm okay.
Oh, okay. All right. So maybe one day we'll do this thing too. Therapeutic communication. It's also interesting, like one interesting topic on the NCLES. Yes, so that's our answer there. Option 3, right? Let's see if that will be all. Okay, maybe this will be our last one, then we can carry on. Someone should read it for us.
The nurse is caring for a 4-year-old child with human immunodeficiency virus infection. The nurse should expect which statement that is aligned with the psychosocial expectations of this age. 1, being sick is scary. 2, I know it hurts to die. 3, I know I will be healthy soon. 4, I know I am different than other kids.
Mm-hmm.
4.
Is it not 4?
Is it not 4? 4, is it not?
Start by saying it is 4,
Oh,
or it
4.
is, don't say is it not.
It's
Okay, so you are we all agreeing that it is 4?
Yes.
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 No. 1.
Hey,
Okay.
someone is saying no.
Yes.
So what do you think it is?
One.
Obi said
I
one.
received two.
Mm.
Yes, who is talking?
I choose one.
You choose one, eh? Okay.
Yes.
Okay. I like your boldness, okay? I like how bold you are. Even though the whole class is going for four, you are choosing one. I like your boldness. But why are you choosing one?
No, it's not like I'm not. My reason for choosing one is not. Let me say, it's not. It's not actually related to what
You see,
is written
don't
here.
don't, don't worry, feel free because everybody is wrong, okay?
Okay,
Yeah, feel
okay.
free and answer me. Everybody is
Because
wrong, don't worry.
I have a 4 year old, and each time he gets sick, that's like it sounds like what he usually says. So, mommy, I don't like getting sick. Mommy, it's so scary. I don't like getting. So it's
But
more like
but
a personal
but do you
experience. So
but do you know one interesting thing about the answer you also gave?
no,
Even though that is also wrong, okay? But
yeah.
but a 4 year old, you see, when you get a question like this is more of how do is it not Sigmund Freud? Like is it Eric Erickson? Like how do we call this?
Developmental stage.
Developmental.
Developmental good. So this is like a developmental milestone or maybe developmental, I mean, growth question. Okay. Was it Eric Erickson?
Yes.
I think it's Eric Erickson. Yeah, something like that.
Yes.
Yes,
Yes. Yes. So the answer here is two. A 4 year old cannot do one. Okay, cannot do one. The best answer is two. And the class is quiet. Someone is asking how, why, how, right?
Hmm.
Let us read. So all depends on if you know your what you are talking about, the growth and development thing, you'll
Oh,
understand.
yeah.
Okay. It's how they understand, I mean preschoolers understand that, okay, how toddlers understand death and how they perceive it. So Harrison gives a clear explanation to all of them in different stages. Right. So option two suits best as in preschooler. Are we there? For this one, before we can really accept, unless you know your developmental growth things by Eric Erickson. So I understand, no problem. If we have all forgotten, maybe we can read later, but this is linked to that. Okay. All right. Um, Now to the next thing. I think we've thought about this already. Um, you remember we've thought about this, so we'll not keep long. Let's see. HIV is a viral infection. So we are talking about multiple strains. Okay, when you have couples with both of them infected with HIV, we are saying HIV is a viral infection of CD4 cells and progressive immune system impairment. Unprotected sex increases risk of transmission of HIV and STIs. So protected sex is important even with HIV positive partners, as HIV positive has multiple strains. So you see, like what I was trying to tell you, HIV positive has multiple strains, and co-infection results in HIV superinfection and hastening progression to AIDS. So you see, apart from mixing up different viral strains, this is another dangerous thing. What is it? Here, it can result in superinfection, like you are combining strains all together in you, which will make your infection a super one, okay? And it can also hasten progression to AIDS. So it can increase how fast you move from HIV to AIDS. Are we there?
Yes, sir, we are there.
All right. So we've thought about this point um to teach couples to use latex. We've thought about this, right? Yeah. And yeah, so I think we have something hidden here. So teach couples to use latex or synthetic condoms. We said these ones were the accepted ones. And or dental dams during sexual activity. Okay. Involving mucous membrane. So these dental dams, I think they are associated with if you're having who knows what dental dam is? Who knows what a dental dam is? Hello. Okay, let us all search for dental dam. Okay. Some people know about it, but don't want to talk. Especially when you are having unprotected sex, right? Sorry, unprotected oral. Let me see. There are some people are seeing some things and they don't want to share it with us, right? Let me see if I can pull it up here. Dental dam. Dental dam. So you see how it is. So it's like a mouth condom, isn't it? Like that.
Hey.
Yeah.
That's my first time seeing this, frankly.
Yes.
Huh?
So much,
So you can see when
so
you do,
much
you
for
see.
sex.
Oh,
Yes.
oh my God.
Okay. So look at this one. I think it can be used vaginally too. Place
Where is
dental
this?
dam flats to cover vaginal opening or anus. So I think it can be used at multiple places in the mouth, anus, vagina, anal, whichever, wherever you want to place it.
Obviously, nobody will use this. So,
By the time you finish,
Okay.
but your friends are gone.
Hmm.
You
Hey,
you it is
Azabegi.
you
my
it
God?
is you that your feelings will go. Why? Someone's feelings will
Enclaves,
come.
Enclaves will teach us things.
The feeling is
Yes.
I
important
tell
than
you.
the protection.
So take note. Okay. So dental dams too also protect you from getting STI. So it is not a bad option. Should you get questions on it? Okay. So right now let's take note. We have latex or synthetic condoms which are acceptable, and we've added this one to dental dams. So when you see something like dental dams, it's acceptable, right? For any route, okay, any route of the sex, it is okay. But you see over here, look at the last point. We are saying lambskin. We are mentioning it again that it does not, protect you or prevent you from getting what STIs, right? So
Hey,
this
but do we
lambskin.
have the dental dams in Ghana?
Do you know what we have in Ghana? There are a lot of things there,
Oh, yeah.
but well, I don't know. It might surprise you. Maybe they are common, depending on maybe the facility. So the thing
Mm.
is, if you are not close to a facility that deals with these things, you won't know, but they are there, I'm sure. And
Mm.
I want us to also look at the lambskin and see how it looks like. Lambskin. Hey, no, let me add lambskin for sex, okay? Otherwise, to give us some leather shoe. or leather bag.
It will give us Willie.
Yes, we don't want. That's not what we are looking for. Let's see what we have. I don't think. Okay, so I think. What is this?
Oh,
Well,
you are. And I am my plate.
I'm not seeing. Okay, so I think there are types of condoms. Okay, look at this one. Lambskin condoms
One on the
benefit.
banana.
See where the one on the banana. It looks so thin that
Yeah, yes. Hey, some people have eyes. Oh. For me, I'm not even seeing it. So,
Oh, really?
you
Just
this is
say
just
me
by
cry
the
me who. I thought it
Oh,
was the
way.
banana.
The search, you can just type lambskin condoms and it will actually give you the actual picture you're looking for.
Good. Then let's see. So they are also condoms. Okay, those of us who are just wondering what they are. Okay, so these are the packages. Let's see. Okay, so here you see
contributing a show.
lambskin condoms. So this one, they look. They said out of stock. Okay, let's continue.
Hey,
So so let's continue. Okay, so this one's they are not able to protect you from STIs because they might contain pores. Okay, they might have pores in them that will make transmission of disease possible. Okay, all right. So these are like ties that after you put on you tie, right? Okay, let's
So
let's
does it
carry
only
on.
protect you against pregnancy?
I don't know.
Then what's the
Whatever
point
it
of
is,
using it?
please, whatever it is not a good one. So for pregnancy, I think yeah, it can
I
prevent
think
some
they don't
semen. I think so.
recommend it because it's really light and very thin. So at
Yeah,
least it can have a tear in it. That's why they don't
good,
recommend it.
good, good. So that's also very laudable. So please, for your English sake, don't choose anything lambskin. Sorry, lambskin. Okay. Dental dams is okay. Latex and synthetic condoms is okay. Yeah. So I think we can carry on from here. And we are saying sharing personal hygiene devices that may have been exposed to blood, like toothbrushes and razors, can also increase your HIV infection and be avoided. Toothbrushes, according to ACE team, I know there are ACE specialist people here, or people who have had special training in this HIV thing. I think kissing, sharing toothbrushes and the rest, I mean, they are very, 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 very low risk factors that can lead to the transmission. I'm sure they are very, very low, but it doesn't mean that they are entirely impossible. Okay, if you have a cat and there is significant amount of blood in that thing, or let's say on that thing, whether toothbrush or razors, and you cut yourself, you can be infected. All right, so that is it. And over here, we are saying avoid raw or undercooked foods, especially if you have HIV. When you have this condition, HIV or AIDS, your immune system is already down, and you are likely to get a lot of infection. So, as a preventive measure, so you see, when someone is neutropenic, you remember all those things that we say. Avoid raw or undercooked foods and vegetables too, okay, and all of that. So this person too, his or her immune system is down, so you'd want to also protect them, okay. To avoid raw or undercooked foods. So these are some of the examples, so that you can avoid foodborne illness. All right, and we are saying teach HIV drug users to avoid reusing or risk sharing needles, right? Syringes to prevent HIV and hepatitis B. So sometimes, we have a term we call ghetto. In the ghetto, a lot of things happen. Okay, yeah, some people, some things when we mention them, they are very uncommon in most African countries. They are very uncommon, but they are very common here. Okay, you can have people, um, it doesn't, what you are saying doesn't mean we don't have some in Africa, but the rate over here is many. Okay, like it's more compared to what we have back at home. We have nurses who are opioid dependents. Okay, I mean they can still patient they can still patient opioids in a way that will even shock anyone. Okay, we have nurses who are there like that, and in most African countries, there are no regulations to check that. But over here, there are regulations to check that. Okay, you see that some people they'll just use it, and I don't know if it's right to share this story. We had one 23-year-old. The person is a Native American. I didn't know he was the one. His case made me understand we actually have Native Americans, and we have just Americans. He was a Native American, 23-year-old boy. He was very, very addictive to these IV things and the rest, okay, like opioids, injectables, and the rest. So I think you see when you start from small doses and you increase. So he took one sharp one. I think he was trying to graduate, and his breast sorry, his breath, okay, his breath ceased. That's what I want to say. So he seized breath like all at once. He ceased to breathe. He had a respiratory arrest. And it has been almost 2 years of in and out admissions. Okay. Over here to when people have chronic conditions, we keep them. We have places we call like assisted living. Those who are here, I think you know. And we have home care, people with chronic conditions, they stay there and the rest. Unless they get acute conditions or situations plus their condition, then they can be moved to maybe an acute care settings for them to be treated for their emergencies. And after they can, when everything is settled, then they can go back to their long-term care. That is how it is here. Okay, so it hasn't been long. I've not even been up to 1 year, but I've seen this person about 3 times. Okay, in and out admission. So what I want to say is that they are common. Okay, maybe from where some of us we are coming from, you can see that plenty, but this middle people using IV drugs, sharing them, you know, they are very, very, very real things happening. So what we are saying is that you teach IV drug users. IV drugs users, it's not in the hospital, but it's at home and in at various ghettos, right? So you teach them to avoid reusing, even if they will use. There's nothing for you to do to stop them. If they will want to do it, they don't have to reuse their injectables, right? Their needles, their syringes, and the rest. And they don't care. I don't know if some of us know how these people they don't care about anything. All that they care about is their highness, how to get high. Whether someone is being infected or what, they don't care. So you have to teach them as a nurse. Don't judge them. Teach them, okay, to help them. All right. I think that also ends there. Um, yes, it's followed by some questions. Let's pick them and see. Some of these questions will bring out some things that are hidden for us to tackle them. Who can read this one for us?
An infant of a mother infected with human immunodeficiency virus is seen in the clinic each month and is being monitored for symptoms indicative of HIV infection. With knowledge of the most common opportunistic infection of children infected with HIV, the nurse assesses the infant for which sign. 1. Cough. 2. Liver failure. 3. Watery stool. And 4. Nuclear rigidity.
Mm-hmm.
What is true?
Cough.
Watery.
What
Three.
is okay? Are you sure?
One. One.
Who is saying
Obia or
one?
the answer.
Why are you choosing one? Do you work with an do you work at HIV facility or something or department? The one who chose one. Are you there?
No, but I think with HIV,
Yeah,
there's a possibility of TB and TB to deal with cough.
Okay. So yes, the correct answer is one. Okay. Please, just to add to our knowledge, what we know already. Whenever you have HIV, I don't know, but if you've realized, those of us who work in bigger hospitals, most, not all, okay, but most tuberculosis patients are HIV infected. Have you
Very,
realized that?
very true.
Yes.
Yes.
Most of them are HIV infected. Not all of them. Okay. So one thing about this is, BCG. All okay. Let me pick it up from here. Most of us walking around, we have this tuberculosis. What's the causative organism for tuberculosis?
Mycobacterium
Mycobacterium.
tuberculosis.
Mycobacterium tuberculosis. So most of us have this organism very dormant in us. Okay. Whether you received it through BCG is okay. So is BCG a live vaccine or not? Have you done my
It's live.
assignment?
It's
Life.
live.
Yes.
You do my assignment too. All
Yes.
right. All right. So by one way or the other, almost everybody has been exposed, okay, um to tuberculosis. Whether you receive the vaccine or not. Okay, so let me talk about if it's vaccines that you received, it means you've been exposed to the organism and you've developed some antibodies to fight against future tuberculosis. Should they come close to you or should you come into contact with any tuberculosis? That's how come we are protected. Okay, that is why everybody is supposed to get a BCG right from infancy. All right, and those who do not get, if they are strong, sometimes their first exposure could also make them develop some antibodies to also fight against the infection to some extent. So, if let's say you've not been exposed before and maybe you're already down and you meet someone with active TB, what you do is that what happens is that when you are infected, your body tries to fight it. If the infection or the causative organism become stronger than your immune system, then that is where it will manifest as fully it will manifest as fully grown. Let me use that term, as fully grown tuberculosis. Okay, that is where the disease will come to stay. For those of us who have taken the vaccine, we've developed antibodies, so it isn't that you can never get. Okay, but it protects you to some extent. All right. So what we are saying here is that um, when you have let's say I wanted to hit on the point. when you have someone who is already immunocompromised, okay, the ability the ability of the body, you remember, okay, so let me put it this way so that you understand. Um, Someone who is already infected, okay, well, let's say for us who have received the vaccine, we have antibodies that we've developed because of the exposure that we had. So we have the BCG, or we have the organism in us. When you get HIV and your immune system drops, so yes, so that's what I wanted to say. If you have, let's say, you get any condition like HIV and your immune system drops, the already
I talk to
exposed
you, and then I
organism
don't
in
know how
them.
you want me to talk to you for you to understand.
Hmm.
Please,
I,
we don't want to understand. Kindly mute.
Oh my
I,
God, I'm so
oh,
sorry, please.
no problem. Everything will be fine, okay? All right.
Chocolate.
So, what I'm saying is, for those of us who have already been infected, who have received the vaccine, should you get any opportunistic infection or anything that will bring your immune system down, the organisms you are already harboring, I mean, in this case, the tuberculosis organism, Mycobacterium tuberculosis, that is in your lungs or it's in you already, will now have um it will now have like strength to overcome your immune system, which is now down. Then it will manifest as a fully grown tuberculosis. So normally, when people get HIV, this is what happens. Okay, it's not that they normally get it from somewhere. It's from the stress of tuberculosis they already have it in them. Remember, BCG is a live vaccine. When you are giving the vaccine, you are giving some of the organisms, and you develop antibodies to fight against future what tuberculosis. When your immune system comes down, those organisms in you, already in you, okay, because your immune system is down to suppress it, they will now come up and grow to be fully grown or fully manifested what tuberculosis, and they will now try to show the signs and symptoms of tuberculosis. So that's what normally happens when HIV patients, come with tuberculosis. Okay, so that is how come. I mean, there are many like that. If you choose, I don't know the rate, but if you are working at tuberculosis unit, you see that most of them tend to be HIV positive. So because of this mechanism, the immune system is down, and the organisms now rise up to become a fully manifested um, disease. Okay. Now,
Please,
you
an
remember?
addition to that.
Okay.
Yeah, I just want to draw our attention that it may not necessarily be through the vaccines we receive. Because it's
Okay.
airborne, we also inhale them. And
Everywhere. Good.
as a result of that, because we are in solid immunity, once we inhale them, we will not be broken down by it. But like he rightly said, if our immunity then go down, then you see that the organism then begin to manifest
Thank
problems.
you very much. Thank you very much for that addition. Yeah.
Hello.
100% truth. Yes, Franklin.
Please, we beg iPhone to change his name. Mm.
This name, I
Okay.
don't know. I've changed it severally. Brahima is your boy, Tony. I've changed it. You've said it more than necessary. I've also changed it more than necessary. But all the time, I don't know why
Okay.
it's you. I'll change it
Okay,
again.
no problem. No problem. Okay. So so one thing I've realized, do you know that oh, how much is it up? Please there. Hey, like seriously? Or people want us to close? All right.
Hey,
So
inclusive.
you. So one thing I want to add up is do you know that when someone is diagnosed of HIV, normally we give them Septrin? Are you aware?
Yes.
Yeah.
So the Septrin is to help
Yes.
them
Coach remote.
prevent them from getting respiratory infections. Okay.
Okay.
Yes. Septrin. Another. I think we have our three names for Septrin. Who remembers the other names?
Coach remote.
Yes. Cotrimoxazole. Okay. Something cotrimoxazole. I think it's two names. Something. So is it for something? I've forgotten the name, but it's
Sulfamethoxazole.
sulfamethoxazole, trimoxaz, trimoxazole. Yeah, something like that. Okay, so it has about
It's
three.
trimethoprim and sulfamethoxazole.
Good.
Yeah,
Trimethoprim.
that's it.
Good. That's correct. Good. Good. So if you don't see that one and you see Septrin or I mean whichever. So normally when people are infected, I mean when they have HIV, they normally take that, okay, to help prevent um respiratory infections. So please take off, not what risk to when you see questions like this with HIV. First, I mean system by system infection they get, not GI, okay, not neuro, not cardio, it's respiratory. And you normally see cough. All right. So this is the rationale. We can read quickly then. So yes, this is it. And this is normally tied to only, I'm not saying always, okay, but normally tied to HIV. Let me pick up my pen and circle around it. The kind of pneumonia HIV patient gets, oh, where's my pen? It's this type, pneumocystic. Then you see this girovacy or something. There's one common, okay, one common type of pneumonia among HIV people. Okay, all right. Now let us look at something.
Is this the pneumocystis that is standard precaution or airborne precaution?
Um, I think if anything, it should be contacts rather. But remember, I think I gave you this trick yesterday. Whenever you see, okay, if maybe I forgot to mention it, let me mention it here right now. Please, whenever you see pneumonia, okay, and you are not sure of whichever area it might fall, whether contact, airborne, or droplet, please choose droplets always. Okay, always choose droplets. But I think it's this HIV one. If anything, I think it should be contact, not standard. Okay, I think I if my memory serves me well, it is only with this one that is contact. Yeah, I'm sure it's contact. But the rest of all pneumonia, please pick droplets. Are we there?
So please, I have a quick question. So what?
Or was it Tony who asked the question?
Yes, please.
So Tony, search for it quickly for us to confirm. Okay. And let's see whether it's droplet or sometimes they even combine droplet and contact. I mean all of them together. But please, if you see pneumonia anywhere and you want to be safe, whether droplet, contact, or airborne, please always choose droplet. Like generally, pneumonia, choose droplet. So that is one trick that works about 99% of the times. Okay. Sister, please you can ask your question.
I was asking if the HIV is contact or standard.
Oh, HIV is standard though. You know, it's not a communicable disease.
Oh,
Communicable disease like disease that you can transfer. Oh wait, oh, is HIV communicable disease or not? Someone should help us. This is tricky. Is it communicable disease or
It's
not?
communicable.
It is communicable, right?
It's not communicable.
Yeah,
No, though.
Really?
it's
What makes
communicable.
Someone, someone should find out because communicable disease are diseases that can be transferred from one person to another. So, per the definition, I know that's why I'm throwing this question back
It
to you.
is.
So, I think it is because you can transfer it from one person to another. Okay, so conditions like diabetes, you can't transfer it from one person to another. So, diabetes is not communicable. Hypertension is not communicable. What else? Hypothyroidism, those endocrine conditions, they're not communicable, right? But I think because you can actually infect someone with HIV, I think that alone makes it communicable. That is what I think. Has
The one
someone
I
confirmed
checked,
it?
it says it's communicable.
It's
Yes,
communicable.
it is.
Good, good. So it is communicable because it can be transferred from one person to another. Okay. Definition for communicable disease are diseases that can be transferred from one person to another. This one we all learned it in class 3, right? Yeah, but so if any condition comes to your mind that you want to know, just be guided that or ask yourself, can you transfer this condition from one person to another? If it is yes, then it is communicable. If no, it's not communicable.
Brahma.
So let that be your guide.
Yeah, Brahma.
Hey, today dear. Yes, sister.
Brahma.
Yes, we are.
Yes, they
Why
said
wouldn't
it's
I say
standard
sister?
precaution.
Yes, yes, brother.
Yeah, they said it's standard precaution.
Oh yeah, HIV standard.
No, I'm
So
talking about the
sorry.
pneumocystis
Oh, okay, okay, yeah. It's standard
yeah,
there. Oh,
standard.
okay.
Yeah.
Okay, thank you very much. So I think that then that is the only pneumonia that is standard. Every other pneumonia is droplet. Can you find out that one too to confirm? And please, what about meningitis?
Droplet.
Meningitis is droplets. Okay. All right. Can we continue?
contact. No, oh, no.
Meningitis, yeah. So it's like between contact is also part, but please for all droplets. Okay, so let me thank you for bringing that up. For all droplet precautions, you have some contact with them. Okay, like we have contact as being part. But should you choose should you be in between contact and droplet, you have to choose droplets, otherwise you get it wrong. You know influenza, right? Influenza, when you come into contact with, let's say, a contaminated surface with the flu virus, you can also get flu easily. But you can't say because of that it is contact. It is droplet. Please, do you understand?
Brahma is viral meningitis also droplet.
Are you asking or you are telling us?
I'm asking.
Oh, most, I'm saying for if you're not sure, okay, if you're not sure, is it viral? You are saying viral meningitis?
Yes, but I know bacterial meningitis is a droplet,
Please,
as you said.
if there's meningitis, for me, I would say choose droplets, and they are mostly correct. Okay,
Okay.
yes, choose droplets. Unless maybe someone has seen something somewhere who wants to share with us. But please, droplets for meningitis. If you see pneumonia and you are not sure of it, choose droplets straight away. Okay. So these are some of the tricks that won't let you learn plenty, but you can absorb. I mean, you can absorb things in groups because let me give you an example. If let's say aside this pneumocystic girovesi, I don't know how we pronounce it. So apart from this one, you can get other forms of, pneumocystis. Is it pneumocystis and everything? Like I've seen lots of them. Okay, different species. You can't learn all the species, and the kind of precautions we have to institute. You can't learn everything, but apart from this one that our brother just found out for us, almost every other pneumonia is dropped. So take note. Okay. So if you keep it in that way, then you can learn in umbrella, like as soon as you see this, yeah. All right. I wanted us to talk about this more before we go. So hepatitis A, hepatitis B, hepatitis C, hepatitis D, and hepatitis E. Do you know we have up to E? Hello, are we there? Or we are tired?
We are here, sir.
Yeah.
Okay. So hepatitis A, okay. When you have hepatitis simply means inflammation of what?
The
When you
liver.
meet something like hepatic, what does it mean?
Liver.
The liver.
The liver.
Liver.
Okay. Yes. So hepatitis, like hepatitis B or hepatitis C or whichever hepatitis you see, at the end of the day, know that it is infection of the liver. All right. I want to make this one simple here. Share something for us on this page. Then maybe later you can come back and talk about it more. So let me see if I can write something here before we go. Okay. So Hep A, Hep B, Hep C, Hep D, and Hep E. Okay. So hepatitis A, normally we say they are what? Fecal oral, right? How you can get them. So when you have let's say contaminated, what goes through our mouth? Normally food and water, right? So when you have contaminated food or water with these organisms, hepatitis A organisms, you can get hepatitis E infection. Okay, you can get hepatitis A infection. So they are all fecal. Anything about hepatitis A is fecal oral, and most of the times they don't get to become chronic. Like they show mild signs and symptoms. Okay, and please remember, as we're talking about hepatitis, all hepatitis. I should have asked you this. So anyway, are they caused by bacteria, fungal, or viruses?
Virus.
Viruses.
Hepatitis is caused by virus. Okay. So the type A is mostly fecal oral through contaminated food or water. Okay, and maybe poor sanitation areas and means. It doesn't normally become chronic. Now let's look at B. Vitamin B, hepatitis B. Sorry, hepatitis B. Um, Hepatitis B is um
Ade
think of it
when you na
think of it like an STI, okay? So you can get it through blood um blood transfusion, through sexual contact, okay, through needle stick, you can get it. And mother can give it to what? To the baby. So how hepatitis can be transferred from one person to another, it's similar to how HIV is transmitted. So you can, I think for HIV, most of us know how, I mean, we are more conversant with how HIV is and the transmission. So you can relate. Okay, when it comes to hepatitis B, almost how HIV is transmitted, every single way, Hep B or can also be transmitted. All right. So in short, it's like bloodborne. Take note. And hepatitis B can be very dangerous. Okay, it can be very, very, very dangerous. It can cause liver cirrhosis or liver failure itself. Okay, all right. So most of the times when a newborn is infected, okay, a newborn is infected, or let's say you have a mother who has let's say a pregnant woman who has this hepatitis B, when they give birth, we have a type of vaccine we give to so take note for English. Okay, we have a type of vaccine we give to the newborn in order to prevent complications. Okay, and that vaccine should be given I think within 12 hours after birth should be given. All right. Okay. And let's move on to hepatitis C. Hepatitis C too is similar to what? B. So how you can bundle, you see, we have B and C in the middle, okay? So bundle BC to have the same means of transmission. They are also bloodborne. Someone has a question. I saw a hand up.
Just wanted to find out the vaccine given.
I think it's hepatitis B, something, something, something. You can search for it. Okay. Yeah,
All
I
right.
mean, for English, what you know is that what you should know is that I mean there's a vaccine, but I don't know whether you can be asked of what kind of vaccine. But
Sir, please, is it enclaves that it is 12 hours? Because I know of 72 hours.
it should be given within the first 12 hours. Where did you see the 72 hours? In an English book? Or it's
No,
like a
please, the
protocol summary?
midwife, that's
Oh,
the
midwives,
range
okay.
within
Yeah,
72
so
hours.
there are some protocols, they are different from the English standards, okay. For what I'm telling you, I saw it in a trusted English book. Yeah, I never knew if we do it up to
Okay,
72
thank
days.
you.
Yeah. So, I mean, the earlier the better. I think in all, the earlier the better. But it doesn't mean that if the baby maybe has passed 12 hours, you cannot give something like that. It's like Rogam, right? You remember Rogam? Um, when do we give the first one? Is it 26 weeks?
28 weeks.
28
28.
weeks, right? Yes. So do you
28.
know that? Is it 28 or 26?
28.
28.
28.
Good. Do you know that? Do you know that I happened to meet? I mean, somewhere last year, or early last year or last 2 years, I happened to meet someone, and the person, I mean, was supposed to get Rogan. Okay, the person had resource positive. The mother is resource negative, and the father was resource positive. So the baby happened to be positive, and um, I mean, they knew that. I mean, the mother was told at earlier times that when she gets to I mean the time they told her, so she knew it that around 28 weeks she should get the program. So she delayed and she was at 30 weeks. You know that she went to the hospital and I don't know which doctor, but it was actually a doctor. The doctor said it's over. I mean, she was supposed to get it in 28 weeks. So it's 30 weeks now, so she can't get it. Can you just imagine? Or do some of us have similar conception here? Does it mean that the person cannot get it for the first? I mean, the first dose.
The 30 weeks we give. Oh.
Yes, I think it's up to 32 weeks. You can give, right? You can check it. I think it's from 28 to 30 or 32 weeks. You can still give. Okay, but the ideal week is what? Is 28. So sometimes these things is like the earlier the better. Okay, I'm just using this as reference. Okay, so what I have with me here, what I chanced on it was 12 hours, okay, for the vaccine to be given to help protect the baby. Right. Yeah, but I don't know about we can search for it and see if the 72 hours also holds.
They said the first dose is within 24 hours.
Okay. So another 24 hours, fine.
Yeah,
So
they said 24 hours. Then the second dose is 1 to 2 months of age. And then the third
okay.
one is 6 to 18 months.
Okay. Okay. So okay, thank you. So it means the earlier the better, right? My source is saying 12 hours. Another one is saying 24. Another one says 72. So it's like the earlier the better, right? But always know that they receive what vaccine to help them
Myself,
protect you.
when I checked, I gave me within 12 hours. So
Come again.
I also googled it and it gave me within 12 hours.
You okay? You've also found 12 hours, right?
Yeah.
So yes. So maybe it can be a range, but the earlier the better. Okay. For what I found was also 12 hours. So it's like the earlier the better. 12 hours is more ideal. When you see 12 and 24 hours, choose earlier times. Okay. If you don't see 12 hours and you see 24 and 72 hours, choose 24 hours. So choose the earlier time. Okay. Should you see it in
Okay.
person, choose the earlier time and you'll get it correct.
Okay, thank you.
But
Okay,
I'm
thank you.
lost. So 12 hours for what?
Hey, boss.
But
My
lots
boss.
of
My boss, we are saying when an infected mother, like hepatitis B infected mother, gives birth, within the first 12 hours, we have to give hepatitis B. I don't know whether it's immunoglobulin. I think, yeah, they give it with immunoglobulin, right? Immunoglobulin with vaccine.
Yes, that's the
But,
name, heavy immunoglobulin vaccine.
oh, okay. So it's like a combined one. So the immunoglobulin part will prevent, like, immunoglobulin, like, fight against active infection, something like that. And the vaccine too will protect you from maybe future infections, something like that. So they normally have them maybe like two in one. Okay, so they give them this vaccine in order for them not to contract this hepatitis B infection. So our brother, are you
Thank
with
you.
us now? So we
Thank
were
you.
looking at when to give this vaccine, right? All right. And our time is fast spent. Um, okay, so I think we should end there. I don't want us to go further. Let me just mention this: hepatitis A, fecal oral, hepatitis B, bloodborne, right? Or how you can get HIV the same way. Hepatitis C too, the same thing. Bloodborne, how you can get HIV transmission, the same thing, right? But with the hepatitis B, you need vaccine. Hepatitis C, you don't need vaccine. That is the trick. Hepatitis V, hepatitis B, there is vaccine. Hepatitis C, you don't require any vaccine. Take note, it's very important. Okay. And what else? So let's go to the E. Hmm. The E two is fecal oral. So what when sorry, I didn't talk about D, right? When I'm talking about this, I normally I normally link it in a way. Okay. I'm coming. In the meantime, if you have any question, you can ask. If you have any question, you can ask. Okay, if no question, then let's carry on. I normally link it in a way, let's say A and E. Okay, like AE here. Then we have the middle one, okay, B, C, D, all transmitted by what? Blood. Okay, like bloodborne. So you have A, B, C, D. The middle part. So it's like the fecal oral is protecting something like that. The fecal oral is shielding the blood bones. Okay, so A is fecal oral. So AE here is fecal oral. Then what you have in the middle here, the three of them, they are what? They are all bloodborne. There is one of these. So my question to close the class, there is one of these three things here. Before you can get, you have to get one before you can get the other. You can't get it straight away. When we come back next time, someone should remind me for the answer to this one. And all the assignments I've given you, I shall take them in the next class, okay? We shall do a lot of discussion. I'm repeating my question to you. With hepatitis B, C, D, we know they are all bloodborne. How you get is the same way you can get them. There is one of them, you can't get it straight away. You have to get one of these things before you can get the other. So when we come and tell me which one you're talking about. That is also one trick. Okay.
I think it's hepatitis D.
It's D.
I don't
It's the
know.
D.
So we
I
want to
don't
answer.
I
It's
don't
D.
know.
Oh.
Just go and find
D
out.
leads to D.
Yes,
Just
D
go
leads to B.
just go and find out, then after you will know what, or how to